There I am. All right, so go ahead and get your, you at home, get your 2.01 review questions out. We're going to go over those right now. Let me get everything like we need it. I'm almost ready. You guys are waiting on me. I'm not waiting on you. Okay, I'm ready now. Are you guys ready? We're good? Everybody ready at home? Okay. So what are osteoblasts? These are bone forming cells. These are the ones that, you know, kind of go along and make new bone. And if you guys listened to my Zoom meetings last week, you'll know we get a new skeleton anywhere 7 to 10 years, basically. All right, number 2, the diaphysis is what part of the long bone? The shaft. And then a fracture that breaks through the skin is described as what type of fracture? That would be an open or compound fracture. Okay. This disease is from an increase in crystallized, I didn't put crystallized up there, crystallized uric acid deposits. They usually affect the great toe and they're usually in men, and this answer is gout. Very painful. I've never had it, but that's what I hear. Okay, the axial skeleton is the skull, ribs, sternum, vertebrae, and the hyoid bone. So if you don't have the correct answers, please write down the correct answers, because, I mean, basically this is the test. If you guys haven't figured it out, if you study these, you're going to pass the test with an A. You just have to have the correct answers. Okay. Describe kyphosis. Rounded shoulders affects, do you guys remember which vertebrae? Well, that's honest. Thoracic vertebrae, thank you for your honesty. And it's basically hunchback. Yeah, remember Quasimodo. So that's kyphosis. Lordosis is the lumbar vertebrae. All right, so what is hemopoiesis? Hemopoiesis is the production of healthy blood cells. What are the functions of the skeletal system? Protection, mineral storage, so calcium and phosphorus, hemopoiesis, posture, movement, support. All right, I'm scrolling down. And at the end, if we need to go back, you just let me know which ones we need to go back to, okay? The inner lining of the medullary canal, and it keeps the yellow marrow intact, is the endosteum. Where is the epiphysis located? On the ends of a long bone. Now, do you remember what is on the ends of the epiphysis? Yes, cartilage. Do you remember what the name of that cartilage is? Anybody? John? Articular cartilage. All right, so this next one, which function of the skeletal system is impacted if you sustain an injury that requires physical therapy? That's the main term, physical therapy. So out of protection, mineral storage, hemopoiesis, posture, movement, support, which one do you think? Movement, correct. So that's the one that's going to be impacted. All right, examples of hinge joints would be the elbow. Hinge joints move in one direction, and the knee. Fracture does not break through the skin, can cause bruising and immobility. Immobility is, you're not able to move it. This would be a closed or simple fracture. Okay, I'm scrolling down. All right, so osteoporosis can cause fracture. What age group is this likely to occur in? Older people, yes, the elderly. Very good. All right, so this vertebrae disorder is a side to side, so it's an S shape. Scoliosis, correct. Osteoarthritis is the normal wear and tear on a joint. Loss of articular cartilage. Painful, stiff joints. So this just comes with, normal, again, getting older. Not everybody, some people will have osteoarthritis worse than others. All right, so describe a green stick fracture and the age group it likely affects. So this is an incomplete and splintered fracture. And what's the age group that it likely affects? Yes, young children. So we're talking infants and toddlers. Likely affects. Yeah, ignore. Okay, scrolling again. So describe the bones that the ribs attach to on the ventral surface and the dorsal surface. So the ventral surface is what area? The front, so that's the anterior. So where do our ribs attach to in the anterior portion of our body? The what? Yes, the sternum. Very good. All right, so if the ventral surface is the front or the anterior, what is the dorsal surface? The back. Or the posterior. So what do they attach to on the posterior side? There's 12 of them because there's 12 ribs. Yes, which vertebrae? Which of the vertebrae are there 12 of? Anybody at home? Thoracic, yes. Very good. So I'm going to put front so everybody kind of understands that. And dorsal is back. All right. The three categories of joints. We have a diarthrosis. And these ones are freely movable. And then we have amphiarthrosis. These ones are partially movable. And then synarthrosis, those ones don't move at all. And those are in the sutures of our skull. The shoulders and hips are examples of what type of joint? It's a diarthrosis joint. Anybody? Ball and socket. What is yellow marrow made up of? Fatty tissue. Describe the lower leg bone. So we have our tibia, and that is the largest of the two. And it bears weight. Let's see how I have it written here. Weight bearing, meaning it holds all of our body weight on that one bone. Then the fibula is the lateral bone, and it is non-weight bearing. So all it does is an area for muscles to attach to. Scrolling down. Describe the sternum. What number is this? 23? Okay, it's on the anterior surface. And it is flat and narrow. Okay, what are the metacarpals? Bones of the palm of hand. The metatarsals are your instep of your foot. And where can we find synarthrosis joints? Your skull, the sutures of your skull. I'm just going to put cranium here. There we go. What does the epiphyseal plate show? If a child is still growing. I'm going to leave it here for a second because as soon as I start on number 27, it's going to scroll down. How's everybody doing at home? I haven't asked in a while, sorry. You guys doing all right, hanging in there? Good, all right. You guys doing all right over here? Okay. All right. So where is the epiphyseal plate located? In the ends of the long bone. specifically the epiphysis. The growth plate and epiphyseal line are other names for the epiphyseal plate. Okay, name the bones of the sternum from top to bottom, and these three bones are fused. They're not actually separated. You have the manubrium, the body, and then the little bone that can be broken off with first aid. With the Heimlich maneuver, CPR, it is the xiphoid process. When would a patient have a cast on? When they have fractured a bone. When they have fractured a bone and have a closed reduction done. A closed reduction is basically where they manipulate the bone, get it into place, and then they put a cast on. Whereas the open reduction is where they actually have to do surgery, and they might use pins and rods and screws and plates. And then the last one, what is the difference between a sprain and a strain? A sprain is damage to ligament. And ligaments do what? Hold bone to bone. And then a strain is damage to the muscle. Treatment for both are rice, which stands for rest, ice, compression, and elevation. All right, so I had some people come in. Well, I was going through this. I think I remember who they are. I'm trying to write them down now. Do I need to go back to anything? Anybody in the class, you guys need me to go back to anyone? We're all good. Phoebe, you're good. All right, what about at home? All right, is that everybody? Do I need to go back to any of the questions? Again, you need to have the right answers to pass the test. Okay, so if everybody's good, I'm going to stop share. Let me double check that I got everybody. Okay. All right, I've got everyone. So study for the test tonight, and that's it. We won't even meet for a Zoom meeting tomorrow because you'll have your test, and then you can actually start on the muscular system. I've opened up that module, but nothing will be due until Friday because of the new 6 weeks. So see you guys later. Unless you have a question for me. All right.